Someone ought to start a revolution.
It's time we rise up. Have vision, folks, please. It's bad as hell, this healthcare quality.
Today, we are celebrating not only our 20th anniversary of the Pittsburgh Regional Health Initiative, but also it's a great time to celebrate the 20-some years of health reform in this country. And may it continue, because it's not done.
The partners, the champions, the leaders, the board, the professionals who lift you when you're down.
The headaches, the heartaches, the setbacks, the flops, the systems who just want you out of town.
The moment when your heart beats like a drum.
The sadness when the progress just won't come.
There's no business like health, business like no business we know.
It's kind of trite to say that this movement stands on the shoulders of giants, but it really does. Dr. Lucian Leape, whom some of you probably knew fairly well, a tall, elegant Harvard surgeon who started digging through data at the Harvard School of Public Health, and then discovered that Betsy Lehman's tragic death from 2 massive overdoses of chemotherapy at the famed Dana-Farber Center was not an isolated event. It is probably the inspiration for us here for creating the Pittsburgh Regional Health Initiative. His discovery that an estimated 180,000 annual deaths from preventable medical injury couldn't be ignored led us on an interesting venture.
PRHI exists vibrant as ever because of its willingness to adapt and innovate. Just from a business person who was here trying to watch how this all came about, Karen had assembled this hard-charging and talented team. They had a high-powered board led by Paul O'Neill. We knew that lean quality improvement methods adapted from business had the potential to transform healthcare.
To Paul O'Neill, we owe an inestimable gratitude. He actually knew Lucian Leape, and in some ways, if Lucian was the one who discovered medicine's sort of deadly hidden secret, it really was Paul who came up with some solutions. What made you think that when we, myself and 2 of my young colleagues, came to see you, you were well occupied as the chairman and CEO of ALCOA, and we asked you if you would help us found a multi-stakeholder collaborative, the Pittsburgh Regional Health Initiative, to make healthcare safer and more reliable. Why did you say yes?
You know, I was really attracted to the notion of using ideas that I was sure from my own experience in creating an injury-free workplace among 143,000 employees in 43 countries, that if we could use those same ideas with regard to health medical care, that we could create a demonstration effect for the whole country by raising the game in Pittsburgh.
We got C. diff in the wards, we've got CLABSI off the charts, we've got sepsis and pneumonia and fevers we can't stop, we've got SSIs and CODIs and a lot of dandy VAPs. What are we not? Infection-free.
I believe our work with PRHI really revolutionized the thinking of our leadership team at the VA. It challenged them to look at things differently and look at all of our processes and services. We worked on hospital-acquired infections. At that time, our rates were pretty good. We didn't feel we had an issue or concern, but we were truly intrigued with the goal of getting to 0.
There's a whole lot of waste in the system. There's a whole lot of waste in the system. The costs are more high as each year passes by, and it looks like they're climbing clear up to the sky.
But we had to prove that perfecting patient care and lean concepts actually worked in healthcare. There were doubters and naysayers. Some of you may remember my favorite moment when the Hospital Association of Pennsylvania called Paul and me the most dangerous people in healthcare for raising expectations. And with that, they threw me off their board.
So enter our own Harold Hill. Oh, I'm sorry, Harold Miller. Harold, who knew little about healthcare until Karen enlisted him for PRHI and ENRI, quickly became the voice of reason and a conscience raising up the issue of why were we paying so much for healthcare? Why were we paying for errors and complications?
Either you are closing your eyes to a situation you do not wish to acknowledge, or you are not aware of the caliber of the disaster indicated by the presence of outrageous costs in your community. Well, you know what's coming. You got trouble, my friends. Right here, I say trouble right here in River City. Why, sure, I'm a lowly consultant. Certainly mighty proud to say, I'm always mighty proud to say it. I consider that the hours I spent with a pen in my hand are golden. Help me cultivate horsehead, and a cool head, and a keen eye. Now, friends, let me tell you what I mean. You got 1, 2, 3, 4, 5, 6 errors in a visit. Errors that often happen between admissions and discharge with a capital D, and that rhymes with C, and that stands for cost.
I was minding my own business, and Karen called me up and said, since you're not doing very much these days, she said to me, could you help me with something? We've been doing this infection stuff for years, and it's just people, it's not spreading. And she says, I suspect that hospitals actually make a lot of money on infections. She said, could you help me figure out if that's true? And interestingly enough, nobody much had really looked at this issue before, and I knew nothing about infections and didn't know anything about hospitals either, but I said, sure, why not? We'll look at that. And we did, and we concluded that in fact hospitals made a lot of money on infections, which meant that they would lose a lot of money if they actually reduced infections.
It's lean, it's fun, it's very clear to see that a handful of Legos help the error rates go down, the error rates go down, the error rates go down.
This was 11 years ago that we started this project, and I can say that it has been successful. It was very successful. Using lean concepts, we changed a lot of different things in our hospital to make care better for that patient.
A fellow geriatrician and I were made physician champions and given the latitude to go ahead and design a project of our own choosing and do it as we thought best. The thing we wanted most to fix was what happens to older patients in the hospital when they are transferred to nursing homes after being acutely ill and not yet recovered from being acutely ill, that leads to them having to come back to the hospital all too often. And guess what? It worked. So we actually prevented some readmissions.
I had the opportunity to go to Israel on this trip with PRHI in 2009. There was the right incentive to get the right care done by the right team. We also learned a lot, and the so what was we could bring this information back to help inform what was happening with the Affordable Care Act.
If we reinvested, yibba-dibby-dibby-yibba-dibby-dibby-dum, all the dollars just spent on value, we would all be healthy folks.
Karen really, it was her idea, it was her initiative. She's the one that sought out Paul Neal. She's the one that started all the organizing. She helped his leadership lead, but she was the leader.
Karen has been a stalwart supporter of ENRI and all of us in this community of organizations trying to transform healthcare at a community level, not only by the commitment of her personal time and energy, but also human capital, financial capital. She has leveraged her connections within the grant-making community and the broader community of organizations that support social change at the community level to help elevate ENRI's profile and make it the successful organization that it is today.
I extend my congratulations to the Pittsburgh Regional Healthcare Initiative as it marks its 20th anniversary celebration of the initiation of its work to improve quality of healthcare offered in our community.
We continue to evolve, not simply for the sake of change, but to address opportunities as they arise and present themselves. It could be a long-standing clinical matter that's been dormant for years, that's been unearthed and looked at with a fresh set of eyes and renewed purpose. And sustainability in this day and age with these types of collaborative initiatives is unheard of, and 20 years is something to be very proud of. That's what distinguishes us from our peers, if in fact we have any peers. I don't say that in a pompous way, but in reality, we are the best. So enjoy the evening, and I'll see you at the next board meeting.
Because the ideas are so powerful, produce such fantastic results, that the chance to go to scale when the right combination of forces and leaders come together, that great things are in the future always if we stick to the work and continue to improve ourselves. I'd like to say a special note of acknowledgement to Paul O'Neill for the power of the ideas and the proofs that he has offered the entire healthcare community, including us, and to Karen Feinstein, who without her determination to skillfully and forcefully and courageously organize a community that did not necessarily want to be organized around great ideas, we would have never made any progress. But especially to all of you, it's been anyone who's contributed. It's been an honor to work and learn with you all these years.
In truths that we told, or in times that we raged, in bridges we built, or the lives that we saved, it's time now to sing out so our story never ends. Let's celebrate decades of work with all of our friends. PRHI, PRHI, PRHI. Measured in health, measured in care, PRHI.
Now we're